Asthma is a condition in which the airways of children are more sensitive as compared to other normal children. By sensitivity, I mean that they would respond by inflammation, by bronchospasm, and this would lead to cough, breathlessness, fast breathing. Sometimes the child will just complain of coughing after increased activity, like if he's playing in the school or if he's laughing out loud, he might just end up with a bout of cough. Certain other symptoms are, they may have sleep disturbances, they may have snoring, they may have mouth breathing, skin allergies. So all this encompasses the spectrum of asthma in children as well as in adults. So there are 4 target organs, just to summarize, and that is the lungs, the nose, the skin and the eyes. Many times there is no problem, but the child will just complain that there is redness and watering of the eyes for no reason, and you keep putting antibiotic drops. So it is not an infection, it is allergy. So asthma is something which is being oversensitive and overreaction to triggers, chemicals, allergens, pollens, which is there in the environment. So asthma is something which is multifactorial. There are a lot of things which contribute towards making a child hypersensitive. So first and foremost is genetic predisposition. So if there is up to 3 generations, we trace the family history and close first degree relatives. So if the uncle, the aunt, grandparents, brother, sister, if any of them are allergic, then that child is prone to. We expect that when the child grows or during the process of growing up, he may become allergic and have symptoms. And the other of course causes are the part of the area where the person is living. For example, urban areas will have more of pollutants, more of pollution, more of vehicular traffic, so they become prone. On the other hand, certain rural areas may have a very high degree of pollen and pollen and the haze and the burning of haystacks and all those things, so that also becomes contributory. So I would like to say that there are 2 types of pollutions. One is indoor pollution and one is outdoor pollution. Outdoor pollution we keep talking about, the AQI index and all this industrial stuff and all that, pollution. But we are ignoring the more important thing, and that is the indoor pollution. So all your cooking, for example, in the villages they are using chulas and sigdis and all those things. So the emissions will have a lot of irritants for the lungs, and the children will develop allergies. So even in our kitchens, when we are cooking, certain reports have said that the AQI goes up to 1000 and nobody is talking about it. So I always say that whenever you're cooking, the exhaust or the chimney has to be on, the door has to be closed if there is a door attached to the kitchen room. Then the other things are the flowers, and I would definitely like to talk about smoking and BD, which most of the Indian households are still having, and the elderlies in the house also having all these habits of smoking, which nobody can really tell them anything. So my request is that the environmental tobacco smoke, which is such an important factor towards making these children oversensitive, we must please curtail upon this. Other things like using chemicals, simple things like using good night, using phenyl in your the cleaning water that you use every day for mopping the floors, all those can produce inhalants which can irritate the airways. So all these things have to be spoken about, all these things have to be curbed. The last thing I would like to talk about is the car hygiene. None of us are talking about the car hygiene. All these perfumes and all these things that we're using in the car, then the car not being up to mark, it's not clean as it should be. Even that makes a huge difference and may trigger a cough, and you wouldn't even know what the trigger was, and the child would be symptomatic for weeks and you wouldn't be able to know what it was. So we have to take care of all these triggers and irritants. Yeah, that's a very important question, because most of the mothers will ask me which cough is a viral infection and which cough is, how do I know whether it's asthma or allergy. So my simple take on this is that 1 or 2 episodes is not asthma. If symptoms like cough, breathing problem, then the child getting tired, older children will complain of chest tightness, all these symptoms which happen repeatedly, they will happen at a frequency of at least once in a month or 6 weeks. So that, and definition wise, more than 3 episodes of wheezing. Wheezing is, breathlessness which creates a sound, a whistling sound when the breath is exhaled, something like this. So this wheezing episodes, coughing episodes which occur recurrently, and more than 3 such episodes which happen in a year is technically asthma. And asthma is a diagnosis which we give only after the age of 5 years, because below 5 years as it is, the children are too vulnerable. They keep going to schools and picking up viral infections. So all those things are not asthma. They are just recurrent infections. Now point number 2, anything which lasts beyond 5 to 7 days is not an infection. Again, if the child is healthy, growing well, and the child keeps having a cough which goes beyond 5 to 6 days, that would classify as being an allergic cough or an asthmatic cough or a bronchitis. We always say that if you don't like the word asthma, it's perfectly fine, because if you call rose by any other name, it remains a rose. So bronchitis, asthmatic bronchitis, allergic bronchitis, all these are one and the same thing. Repeated episodes, and like I've already told you that symptoms in the night, we are all ignoring. Most of the parents will say my child sleeps very well and snoring is a sign of good sleep. It is not at all. It may not always be normal, because snoring means there is an obstruction to the flow of air into the nose, and as a result of this, the child will sleep with the mouth open. So we would always ask for symptoms like tossing and turning. Is it too much in the night? Then is there mouth breathing? Is there any foul smell even after the child has has cleaned the teeth and has done the brushing? Then things like bedwetting which goes beyond 3 or 4 years. That is definitely, most definitely, it is a nasal allergy plus minus adenoid enlargement. Then nightmares, night terrors, child who gets up in the night and gets scared, all those could be a sign of nasal allergies and adenoid hypertrophy, like we call. So all these things have to be taken into account. Now I would also like to mention about the allergic march. So in the first 1 year, the children will usually come with skin allergies, which is called as atopic dermatitis. So if a child comes to me with lots of rashes in the first year, and if there is a family history, I would definitely keep the child under watch, because that child is prone to developing recurrent allergies later on. Between 6 months and 1.5 to 2 years comes the march of food allergies, because that is when the weaning starts. So all your food allergies, your milk allergies, your egg allergies, all those would start at this time, and then they will grow out of it. So you can't have a 7-8 year old having food allergies. So that myth also I want to bust, that please don't restrict food intake, banana and rice and milk unnecessarily, because that does not lead to allergies in later childhood. After the age of 2, it is usually the respiratory allergies, the asthma and the bronchitis and the chest congestions which come in, and after adolescence it is the nasal allergies. So this is how, if the child comes with skin allergies or food allergies, then we keep him under our follow-up, and then definitely we have a low threshold of investigating and low threshold of treating such children. So treatment, I would like to emphasize that asthma is a clinical diagnosis. We don't really require any investigations. No blood tests, no x-rays. We usually treat the child for a good 1 month. If we don't get the results as expected, only then we go ahead and investigate the child. So we start with home remedies and prevention, because if we can prevent a disease, that's the best cure that we can offer to the patients. So in prevention, I've already mentioned the indoor pollutants, the outdoor pollutants. So, what precautions can we take? When we are cooking, preferably the child should not be in the immediate area. We should put on the chimney, the exhaust, keep the door closed. We should not have carpets, wall carpets, dried flower arrangements. Most of the allergies happen in the night. So, bedroom should be free of clutter. Because dusting in our country, even if you're doing it meticulously, again in the evening the dust comes back. So keep it dust free. The curtains should be of a material which can be washed in your washing machine frequently. The mattresses, the bedding has to be aired. The sunlight has to, they have to be exposed to the sunlight. The room has to be aired. The room has to breathe. You can't close up the house out of fear of pollution and COVID. We have been through bad times, and that results in the indoor pollutants circulating again and again, and that is the cause of all the problem. Then pets, definitely we don't encourage pets. We don't encourage any chemicals. Nowadays children have started using perfumes, parents are using it, deos, scented candles, barbecues, chulas. Like I said, all these are important things. So all these we could avoid. Flowering plants, because that is where the pollen is coming from. So many times cigarette smoking, I've already said, as the most important thing that needs to be controlled. Many times you're taking care of all the things, but your child, please watch where he's going to play in the evening. If he's going to somebody else's house where there's a dog or a cat, or where the family member is smoking, then he would again get triggered and come back, and you'd be in a thick soup. The outdoor pollution, yes, try to avoid sending the children to play when the peak traffic hours are there. If you're traveling, even travel during peak traffic hours should be avoided. If you're traveling, you must travel when the traffic is at its minimum. Try to avoid going out when the AQI index is high, because it's reflected everywhere nowadays. It is not difficult at all to trace the AQI index. And when they are going by the school buses or in the cars or in the vans, please ask them to close the windows 100% whenever there is a traffic signal, so that they are not being exposed to the car exhaust fumes. In the school, definitely perfumes and all those things. So we can try and limit things till the extent we can avoid. Whatever we can't avoid, you have to live with it, so that's okay. And like I said, food allergy is not at all going to matter after 2 years of age. Other treatments, if your doctor, you must have a low threshold and go to your doctor, discuss the problem, be open to accepting the treatment wise. Sometimes we may give something which is Montelukast, a very simple medicine which is given just once a day. Sometimes nasal sprays, inhalers and spacers, all these are offered, and they may be given for maybe 2 or 3 months in order to have a good control if the child is having significantly more number of symptoms. Others may just require whenever there is a problem. So don't be averse to accepting these modes of treatments.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.